chase. 405 is the freeway, slinging my banging, my swinging, my coup. DeVille, scoop, DeVille.
Welcome to Neutral Voices. I'm Dr. V, and this is In Depth, where we dig deep in the trenches of what matters. And tonight, what matters is prostate cancer. So we're going to dig a little deep into prostate cancer. And my first question would be about fear. And the reason I say this is because I've been around a few guys here in the studio, and I've heard you guys speak of not wanting to go get this test.
Well, fear is a good word.
Yeah, so I just want to start off with that. Okay, you say an embarrassment. Yes. That was my next one. But so, fear.
Yes.
Fear comes from somewhere, meaning you've never had this test before, but you must have heard something in the barbershop.
No,
go ahead. I'm answering it.
The fear is how they check it. Mm-hmm. That's the fear.
Okay, so you went to the doctor. The doctor went through the process and said, "This is how we're going to check it."
Well, mine was different. I actually got I had to do blood work, and they took 6 vials of my blood. Okay,
they were looking for something.
Yeah, I checking out on the other end.
Okay, wait, because here at Neutral Voices, so we aim to help our community.
Yes.
So tonight we are having transparent conversation, a real conversation, about prostate cancer. So stay with us because you're going to learn something. And you may even want to share something.
Right. So. Now, you say fear. Fear, yes. And embarrassment, yes. And I'm going to combine them both. Unlike E, I actually had to go through the actual, and it's called the digital rectal exam. That's what it's actually called. If you don't understand what that means a doctor puts on a glove and he inserts 2 fingers into your rectum.
Into your no-no hole.
Wait, because see, guys, he wants to make this a little fun because he has to do that, so you don't be so scared.
Right.
So he has a different term for it.
The no hole.
So if you hear him say that, yes.
I mean, but I got it. It's the ease. It really is to ease it because, like I said, I didn't have to get the no hole check. I went through
the PSA, which is the prostate-specific antigen testing. That's through your blood screening and things like that.
Mm-hmm.
But the only scary part about it was going through that way. I actually went to the cancer medical center. So when you walk up in there and you see cancer, and your mind said, it's a strong possibility because I had to get it checked because I had something going on with me.
Exactly.
So it's the thought process like I'm really walking into this building.
Right.
And it's a whole nother ball game now. I mean, I make jokes and fun on it because I'm cool with it. I know I'm clear of it, but it's just the thought process of I am walking into the cancer center.
Yeah,
that's right.
Well,
I agree with
he was a little bit braver than I was.
I had no other choice.
I'm gonna be absolutely honest. And you think about how in his term is no hole and going into the thing. I mean, it's an actual somebody's invading your space. I mean, your actual body. Mm-hmm. But they say that is the best way because they can find the masses quicker than going through and waiting. Because some tests, it might not show up in your blood, and some tests might be off. So the way to find the mass is to go look for the mass. So, but I told the doctor, I said, "Doctor, I'm gonna be honest with you. You gonna have to put me out." He was like, "No, we need you alert and." So we can talk to you. Mm-hmm. I was like, no, you don't need me alert for this. You don't have to put me out. Legitimately, they had to. And some people, and it sounds fun, but it's that's where the fear comes from.
But and that's what I was getting ready to say. So I'm not laughing at that, but what I am kind of making light of is the fact that I'm thinking about women, and I'm thinking about the exams we have to go through annually.
Right.
And we are invaded on a regular basis.
That's true.
And so just to hear you say that this is one of the reasons, so that whole fear factor, this is one of the things that will keep men away from
It's one of the things that
going
do.
to get this.
It's
this
one of the main
test.
things that keep them away. Like I say, the fear and the embarrassment, and
And the embarrassment. So I'm just trying to see if I'm a young man, or is there a certain age I need to be worried about this? I feel good. I'm fine. So, I mean, do I just have to check this out? I'm 18. I'm 19. What causes me to have to be concerned about prostate cancer?
In past times, they would say anywhere between 45 and 50. But in recent times, they're suggesting at least about 40. You start getting those screenings. You start getting those checked. It could actually start with at 40. You can just do the PSA test. You can get the blood test. You can
at
get
40. It's okay to start the testing.
Yes.
And that test looks like the needle drawing blood.
That's when they draw the blood.
That's it.
Yes.
And so you get the test results back, and the test results reveal something.
Yeah, it don't reveal. It would reveal if the test results reveal anything remotely that look like you might have it. Now you have to go to the next step.
Okay, so that's what I wanted to see. So there's different phases.
Yes. So now,
so I didn't know if there were different tests, and you can take this one or that one. So what you're saying is this blood test is one thing that's going to say, hey, something's going on.
Right.
And then we move into the actual what you're calling PSA.
That's the blood test. That's the
blood
PSA.
test.
Okay.
Then if your PSA, if there's anything that comes back in your blood or anything that comes abnormal, anything that comes back abnormal, they're going to either have you do the digital rectal exam, or they're going to put a scope. They're going to use a scope you. So
digital rectal exam. Okay.
If anything comes back in your blood, they scope you. They're not.
That's what
they're not doing they putting you out and scoping you at that point. So once you get that, that's when they could be like, okay, now you have XYZ or you don't, or because the blood test don't give all the answers,
right?
But it gives a baseline. So what they did with me is they took 6 tubes of blood just for that one test. So they can have a baseline and say, okay, this tube is cool. Wait and do the next tube, and it's like I end up getting my final result a week later.
Okay.
Because they have to let the blood sit in different stages of it.
Okay, so there's some processes going on. And so at some point, when they do the digital and then they can find out something, so let's just say worst case, so I'm so glad for you guys that you didn't have anything, everything worked out, and now I know you're encouraging your male family members, etc., to go and get the test.
Right.
Okay, so meanwhile, for those people that may not be so fortunate and they didn't catch it in time, or they didn't even go check maybe, and so they have to make a decision. So they do a biopsy,
right,
where they do a snip, they make a cut, run that through the process, it comes back. Let's just say instead of it being benign, which would mean you don't have it's not cancerous, but it is cancerous. So at this point, is this when they say, okay, what do we want to do? So we can move forward with some treatments, medication, and watch it and see if it grows? Or is this the time when they say, okay, it's time to take it out? And I was talking to you about that, and I was talking about the radical prostatectomy or something like that, and so they're removing your prostate.
Right, correct. Now, it's like any other cancer. When they initially find it, it depends on what stage they find it in. And it depends on how bad it is. Now, if they find it in the early stages, they're probably going to give you some kind of medication, maybe try to do chemo, radiation. They're going to do even up until stage 4. Stage 4 is when they're going to be like, we have to move immediately.
To take it out.
I think stage 3 is actually, they're going to try to, do you want to take it out? Do you want to do surgery? They might not remove the whole thing. They might go in and remove a tumor or a lump or, and then, see if that heals it. But then if it's too far gone, yes, they will try to radically say, we got to get it all out to save you. That's just like a woman with a mastectomy. Once they found out, you can either have the lump removed out of your breast or you have a total breast removal. So it's the same process.
Right. So I want to put these numbers out there. 288,000 men are diagnosed
Yes.
with this.
Yes.
And this is annually.
This is annually. And they say 1 in 4 black men are.
And that's what I was getting ready to say. And so of these numbers, the greater would be the black men.
Yes, that's what they say.
And I think that's interesting because I asked several black men if they were related or connected to somebody that had prostate cancer or that has it, and the answer was no. So do we believe these numbers, or are we being blamed for this too? I mean, is this real or what?
Well, let me take this one.
Go with this one.
Because it's funny how any illness or mental illness or cancer or any sickness, the black man is always at the top of the list.
Really?
As they can get it, and it's aggressive and this, that, and the other. And the funny part about it, what they fail to realize, the melanin in our skin are actually healers.
Right.
So if my skin, my melanin,
You got more melanin than
than anybody else, and my melanin is a natural healer,
yes.
Why am I always the highest
To get
everything?
Yeah.
But the downside of that is we so high because we won't go
There we
and
go.
check.
Yeah.
Okay.
I think
that's something to think about.
Yeah,
I see
and
where you're
I
going with
would
that.
agree with you. I think the numbers may be a little bit skewed or convoluted because when we do go, a lot of times it's in late stages when they find it. You know, because they say test at 40. I know people that's 40, that's 60, that still haven't
Have
gotten the test.
never had the test.
So when that 60, 65-year-old go in and they find it, they're going to be like, oh, you know, and it's aggressive, but you don't know how long, because you don't know when it started, you know, how long it could have festered for 20 years and got to that point. But they're saying, oh, it's aggressive because no. So I don't think it's 100% sure, but again, we got to take ourselves and be proactive.
That's what I was going to say.
So we could, you know, let's stop not looking, because we as black men don't go to the doctor, period.
Okay, so I was going to get there. So let's not be a part. Let's not be a part of those 35,000 that they say will die annually.
Right.
That's a lot of men.
Yes.
35,000 annually.
Right.
And so looking at that, if it's true, and let's just say the numbers say 70% are the black men. You just made a valid point. Why don't you guys, black men, go to the doctor like you're supposed to?
Again, it's just.
And let's not think about prostate cancer. Let's just say, period. Why don't you go to the doctor?
In general, we were never geared that way. You know, my father never told me. I rarely saw my father go to the doctor
that's what I was
until he
ask
got
you,
sick
Clarence.
later in life. But
Fathers,
as my father, you know, he just worked, and when he got sick, he just shook it off. He did,
Okay.
you know, I'm gonna do this, and I'm gonna do that. And, you know, he shook it off. So he never went to the doctor. So we're not conditioned
to go to the doctor.
Or, you know, yeah.
We're not conditioned. And I just had somebody ask me this question earlier today. Do you have to fall out to be going to the doctor?
My family asks me that all the time.
And, you know, up until, you know, a few years ago.
Yes, for women, women sometimes too.
Yeah, but up to like a couple years ago, which y'all know.
Yeah.
I was sitting here half.
Yeah, you wasn't listening to me because I was like, you.
Yeah.
Right.
So after that point, I'm going to the doctor I used to go every 3 months. Now I go twice a year. So it's not hard. But then again, on the other end of that, it's a lot of men that don't have health insurance.
That's true too. And then
that's a major.
And then a lot of us don't want to know. Let's be honest.
Okay, you just want to live your life.
We just don't want to know because you know, if we know, then you know it changes our lives. So a lot of us don't want to know, so we don't go
That's
because we don't want to know.
I know, but that in itself should be scary because you're walking around, you don't know what day could be your last day. What, you know, even for your family, for the sake of your family, you should want to know. I would
they
think.
say what you don't know can't hurt you.
But it can hurt you.
It
You
can
can land
hurt you,
up. You can wind up in a place you don't need to be.
But see, you can also go to the hospital and not be as sick as you think you are and come back zipped up. So you have to look at it from that end too.
Yeah.
That's that fear factor.
No, but I mean that you have to look at it from that end too, because let's be realistic
It has
about
happened.
it. Doctors are not made and not paid to heal you.
They paid to practice.
To treat you, yeah, that's why they call it.
That's why it's called practicing medicine.
Practicing medicine.
So what here and what might help Clarence might not work for me.
Yes.
It might kill me, and you don't know, but you practicing on me.
Right. Yeah, and that's where.
So you have to look at the broad picture of it. Like, okay, that's why a lot of people, hey, if I don't know.
Okay,
cool.
and I get that. But because it is the second leading cause of death as far as the cancer, it is the second leading cause, cancer cause for men. I think y'all need to start some kind of campaign in the family, do something so that you can encourage people, whether it's in the church, etc. You got to do something to encourage people. Do you know of anybody that's having like a drive for prostate test exams? I know Joe Ayers.
Yeah, Joe does. Yes,
Yes, he does the
I think
screening.
he does his like every couple of, at least once a month. He has something on a Wednesday or a Saturday. So he's very active in doing it.
Absolutely.
And I commend him and his group that he does a lot of that too. But as a general, no. And here's the thing. Again, especially in our community, we don't talk about our health. You know, it's rare that we tell our partners or our family what's going on with us. And I'm not going to tell, other people.
Strange. So y'all not talking about this in the barbershop?
No, this is one thing.
I was going to say, because when we opened up, I kind of made a joke that this is talked about in the barbershop.
Yeah, no, we don't.
But I'm thinking that's a good platform.
Yeah.
That's a good place
Great
to
platform.
have the conversation where you can help black men in particular. So with that being said, so let's look at some of the signs. So what are the things that I'm noticing? I know I hear people talk about something with their urine. What you called it, a pee stream or somebody.
Yes, pee stream.
So what does that? Talk to me about that.
Now that is one simple sign, and I know it sounds juvenile. I know it sounds passe, but how are you peeing? The force behind your urination. Do you go to the bathroom and have to stand and wait for the urine to start? Are you standing there waiting for your urine to start? Or is it dribbling? I mean, these are signs, that it's not saying that that's what it is, but these are signs that could lead to it. And that's just one of the simple things. Is there blood in your urine? You got to check that. And
so wait, so when you say that, I'm saying, is it that you need to pay attention to whether your urine has a tint to it? Is it darker?
That could be one too.
Okay, so if
it's a whole combination to take the force, the length that you have, even how it comes out. Like I say, if you're dribbling anything, if there's blood in it, the color, there's all of that, as simple can give you inclinations that there's something that could be wrong.
Are there, I'm just thinking, it sounds like some pain's connected to it, but is that necessarily true?
Yes, there could be pain.
So you could have some pain. So I thought it was interesting that a lot of people don't even get symptoms. Most people
a lot of
never
people,
get symptoms. And so that's why it is so important for men to get checked on a regular basis.
And, as you said that, the symptoms, you may not notice them. You may have them, but you may not notice them. And it's a little bit. It's PG-13, but it's not gross. If you're still sexually active, with your urine, it goes with your ejaculation as well.
Blood in it.
When you say it goes with it.
Yeah. If you have blood in your semen, if your volume of semen, can you produce semen?
Now, I'm glad you said this. I'm glad you brought that up. But so just thinking about what you're saying, this sounds crazy, but I gotta ask this question. And this question is to help. How many men actually see theirs?
You don't see it, but you know.
No. You talked about the ejaculation.
Well.
So with that, how many men? Okay, I don't want to embarrass you guys, but because we're all adults, grown people.
It's all about.
But I'm saying honestly, that's something to look at.
That's something to look at.
Okay, so I'm bringing that out and saying that because when you said that, I'm thinking like, how many men actually look at theirs to even know?
But even with that, the same symptom that the same thing that would be in your ejaculation or your semen would be in your pee.
Yes.
Okay.
So if you got blood in your pee and you can barely pee, and it's hurting to use the bathroom.
Okay.
So it's the same thing either way it goes.
Yes.
So you'll be able to see it.
Okay.
Yeah.
One way or the other.
Yeah,
So whether
mix.
you're sexually active or not,
Yeah.
something, you should get something
Something
for those people that will have signs. So we're going to get this test how often?
Well,
After 40, we go.
Every 5 years. They say from 40 you get it every 5 years.
Okay.
For 40 to I think maybe 60, it's every 5 years. After 60, they do it too. But they also, within that 40, they say if you're predisposed or you have a family history of cancer or specifically of a specific cancer, they want you to go every 2 years, to get checked. So I have mine. I'm about due now because my last one was
2 years ago.
No, it was about 5 years ago.
Oh.
I just turned 50.
You better get your appointment.
Probably almost a year late. Yeah.
Oh, don't be late now, because it's
but I got to work up to, and that's not being fun. I'm not the only one. But you were also talking about. Do we talk about it in forums? Yes, there are people that form groups. That and they annually go
accountability.
Yeah, the accountability
groups or partner groups.
They make sure, and I think that's one thing. And I said we don't talk about it, but I think that's one thing that we should have a conversation.
You should have that.
Be able to group together and say, hey, I got to go get my check. When's the last time you got your check? But again, those things that man, we're not going to talk about. But there's some things we gotta stop not talking about.
That's right. So while we're talking about that, and we're trying to help, and if you're just tuning in, this is Neutral Voices in depth, and we're talking about prostate cancer. So let's talk about the diet. If we have 3.5 million men walking around with it right now, they are survivors, and they have been diagnosed with this.
Right.
So they are doing something right now and probably living a certain lifestyle to stay healthy. What type of diet, I would say, are we doing that may cause prostate cancer, or what should we be eating?
Well, one thing you need to think about is your diet. As your body gets older and more mature, you can't eat some of the same things you ate when you were younger because your body doesn't process those foods in the same manner. You don't expel as much as you used to. So you should think about some of the things like nitrates and meats and things like that. They say a high fruit and vegetable diet, eating certain nuts and different things, can help you with your to prevent it or minimize your risk. Also change factors in your life, be it smoking, drinking, and you might not think about it, your sugar intake, your caffeine intake.
Okay, that's bad or good?
It's bad.
Caffeine?
Caffeine.
See, that's the part that messes me up, because sometimes you're reading something and it's saying you should have a cup of coffee a day. I just got that with my situation. Somebody was saying coffee was good for me, so maybe 2 cups of coffee. And then now I'm saying for this situation,
it's also in how your body processes things and everything. Yeah. So there's no absolute to anything. And as he said, the one treatment might work for him, but it won't work for me. So again, it's practicing medicine. So there's no absolute that this is these are things that they say that are preventative. Even drugs. They say even prescription. We think illicit drugs. So there's some certain prescription drugs that changes your body makeup and your chemical makeup. So there's a lot of things that you can do, but diet is one of the things that you drink a lot more water, make sure you're hydrated, you're flushed, and things like that. But it just depends on your lifestyle.
So one of the things then with you saying it, I would say is just because, and if you were diagnosed with prostate cancer, it does not mean that it's the end for you.
No.
And so especially if you're acting early and you're doing your test on a regular basis. So that test will be every 5 years, and so 5 or 2 years, depending. But so for those people, and we talked a little bit about, I'm going to say sex in a sense. So do you think that a lot of men are afraid of the whole prostate conversation and the test? They don't want to know because they feel like it's going to interfere with their sex life, which it very well may, if they had prostate cancer and they even were treated and cured. How does it change the sex life?
And I think it would depend on the age of the male too, and the active. But
especially if he's a young man.
Yeah, I think
maybe like you said, early 40s, and he find out he don't want to hear that.
And me and E were speaking of this, and E had a different point of view.
I'd like to know what that was.
Well,
no.
Your not only your ejaculation, but your erection. You can lose that, and you think you go get these pills and things, not
Viagra, and all this stuff,
not thinking that it might be a greater problem. You just think you just need a little boost, a jump start, but that could be an actual problem. And
okay, wait, because I don't want you to go past that too fast. So what you're saying, if there's a man, talk to the men, right? So if you're having problem with your erection,
yes,
you're saying
go get checked.
That could be a sign.
That could be a sign. Yes,
that's a sign.
That's a sign.
Ooh,
that's a sign. That's another sign for colon cancer as well.
Let's help the people then, because I'm sure there's a lot of men that didn't know that. They just probably thought it was the ugly woman. No, I'm just kidding. Okay, just kidding. Just kidding.
We gotta have you gotta laugh a little bit. Laughter is good for the soul.
Okay, so. You better get checked.
Yes.
If you're having that, especially if it happened more than once.
Yes.
Okay,
well,
gotcha.
It's not even about happening more than once. It's just you lose it. Period.
Okay. Yeah. And I don't know what that means.
Well, you become impotent.
You become impotent.
Gotcha.
So if you at that point, yes, you need to go and seriously go get checked, because there's a lot of things that could be wrong with you. And at this point now, you need to find out what's wrong with you, so you can get it fixed get it cured. Because a lot of things, and people think it's not true, but losing your erection
is major.
Is major.
Yes, it is.
So if that's one of the reasons that one of the things that you got going on. First things first, stop what you're doing, go get checked.
Go get checked. And speaking of, not to go back to ejaculation, but you talked about the blood.
Keep going back to it.
I got to. I'm trying to help my people. There could also be pain associated with just a normal ejaculation.
Normal ejaculation, urination, there's pain. It could be from your groin area up to the lower back, and that's another thing.
Wow.
You got to think about some of the things that you go through. But some of the pain can actually reach up into your lower back. So you think you got lower back pain, and you go to the doctor and they can't find anything wrong. It's not the physical. It's maybe in your head. Maybe you strained something, but it's a repetitive lower back pain. It could be from go get yourself checked.
Wow. It's a lot.
Yeah, it's very serious.
It's a lot, and you know what? And I'm thinking, our time. I think I got a signal somewhere. Our time is almost up here, but you know how with the cancer, all the other cancers, there's these ribbons that people wear, and especially for, I'll say, any major disease, heart disease, etc. So, do you guys know what color the ribbon is for prostate cancer?
Is it blue?
I knew you was going to say blue.
Yeah.
It's actually silver.
Is it?
Yeah, blue was already taken.
Okay.
And so I think, do we have a prostate cancer month or men's cancer awareness month like we do for women and breast cancer?
Yes. Well, actually, September is Cancer Awareness Month. Breast cancer
all the way around.
Yes, and it talks about, there's different observations, but September is cancer. But, then there are other months that focuses on other cancers. Like October is breast cancer.
Yes.
But, I don't know when it is, but I do know September is overall Cancer Awareness Month.
And that's what I'm wondering. So, you know how they also do the march and things like that, and they turn the city pink, and I'm just wondering if you guys...
No, we don't get that
but
treatment.
That's because somebody has to start it. You got to take it and do it, make it a movement.
But see, most people the people that started breast cancer actually had breast cancer and survived from it. That's who started the movement, the pink. Yeah.
So you saying it's going to be a man, it's going to take a man
that's been
survived it.
Survived it. Yeah.
Yeah, or just concerned Okay, my goodness. Anything else y'all want to share before we exit?
I just want to say this to, as you say, to all of us as men, my brothers out there, my age or a little younger or a little older, let's stop neglecting our health. Your health is your wealth, your liveliness and all of that. But we too many times we're laxed and we perish for lack of knowledge. So let's stop perishing and let's get the knowledge and let's do what we need to do. Our family needs us and everything. So get yourself checked. Don't be ashamed.
That's right. Thank you. Thank you for that. And so this is Neutral Voices. And as we always say before we exit, E?
Always protect your mind.
Thank you.
Chase 405 is the freeway, slanging my, banging my, swinging my coupe. DeVille, school.